Growing up, you probably heard your parents say multiple times to turn the volume down, and now you find yourself giving the same warning to your kids. The risk of hearing loss is nothing new, but a recent report from the American Academy of Pediatrics warns it can even start at infancy, calling the hazards a public health concern. Joining me now is Dr. Pamela Schoemer with UPMC Children's Community Pediatrics. She has some important advice for parents, and I'm so glad to have you here.
Thank you for inviting me. It's a really important topic.
It really is. It reminds me of that insurance commercial where we're all turning into our parents, but
Absolutely.
there's something to be said about noise.
Correct.
So tell us about the differences, especially with kids, that makes them more susceptible to this than adults.
So when we think about kids, their ears are smaller, so that sound is transmitted in a different way. Their canals are narrower, so those high frequency noises hit that eardrum at a higher rate and actually is more effective. But they're also developing, so oftentimes they don't know what that sound is, so it has a bigger effect. Their nervous system is not quite as mature yet.
Does this have anything to do with why we see kids, as their ear canals are developing, more ear infections and that sort of thing too?
So it's a little bit different in that way because that's more about draining the middle ear, but certainly if they're having middle ear infections, it's also affecting their hearing.
That's right. So what are some best practices, instead of just always yelling to turn the volume down, what are some best practices that kids, teens, and we adults can do?
Right. Well, as I say, I think the first thing is we have to model it, right? So we have to make sure that we're not always having our earbuds in, or that we can't hear what our children are hearing through those earbuds outside.
Something really interesting, I read an article not too long ago about how environmental noise is huge. And what happens is there's a lot of noise outside. Construction is going on, there's a lot of traffic, so we wind up turning up the volume on other things, and there's all this competing noise that's coming at us.
Absolutely, and most of our noise isn't regulated. So when we work someplace, there's noise levels, but our world isn't.
Right.
So it can be distracting to children. It can help their speech can be different, but not only them speaking, but also them understanding speech because of that background. And it doesn't have to just be outside noise. It can even be appliances in your house. It can be that white noise. Children don't know where that sound's coming from. They can't turn it off.
I'm so glad you brought up white noise because so many use white noise to go to sleep. Is that like the constant, I don't know what you would call it, sound coming in? Is that dangerous?
So it can be, and so really the recommendation is to use it for short periods of time at the lowest volume and away from the baby, because if you use it for a long time, their speech is developing, so if they're always hearing that background noise, they're not learning those sounds.
Oh my, and this is even at night? Like
even
you
at
have
night.
a white noise machine to help your kids go to sleep? Oh my goodness.
So setting a timer and making sure it's on as short as it can be is really important.
This is good to keep in mind because I know in our kids' rooms we use box fans to kind of like create a white noise, also cool down the rooms, but it goes in the same.
Absolutely, and hearing loss is cumulative, so oftentimes it's not necessarily just how loud, it's how long we're hearing those same sounds.
Okay, I'm having that parent guilt that's sinking in, that's realizing that I'm contributing to long-term hearing loss right
Probably not that box fan that's going to cause the issue, but it really is just something to realize that we should appreciate silence sometimes, take breaks from those noises.
So when we talk about kids and teens especially, they're not always going to be apt to listen to us. So how can we tell them to turn it down? What kind of things can we say to them?
Right, so I think the biggest thing is they should be able to hear you when they have those earbuds or those earphones on, and if they can't, then there may be a consequence to that.
Okay.
And again, having them take breaks.
So you talked a little bit about speech when it comes to infants and developing speech when they're younger, and that might be a sign that there's some hearing loss going on.
Absolutely.
What other symptoms and signs can we look out for?
So certainly if they don't startle or react to loud noises the way that you might think that they do, or getting their attention through a noise is more difficult than you would anticipate.
When does that all fully develop? I know that there's still a possibility of hearing loss because of loud noises, but when does that fully develop?
So really our hearing develops into toddlerhood.
Okay.
And then our appreciation for different sounds and what is causing them even into adulthood.
So later on in life, teen years and that sort of thing, even though this is fully developed, can we talk about the long-term impact of excessive noise, whether it be environmental, through our headphones, all of that?
Right, so what we talked about developmentally is true, but also stress, being able to concentrate, being able to achieve in school, If you can't take the time to do your homework in a quiet situation, you may not perform as well. And then there's self-esteem issues,
Right.
Because you may be more isolated if you can't hear as well.
The hearing test, is this how they would do it? Because I always feel the pressure when we have to do hearing tests and you're trying to figure out which ear the beep is coming into. Is that how you could get your kids tested though?
Absolutely. So most times when you go to the pediatrician, there's a frequency that we do screening tests. And then if they're abnormal and the exam is normal, we can do a more full-fledged hearing exam to isolate the issues.
And there's really nothing we can do about environmental noise, right? It is what it is.
It is, although we can do some things. So if it's outside noise, you might be able to put an extra set of curtains up. You may be able to take a break from that. Inside your house, that environmental noise, you may be able to plan activities around other things. So maybe not running the dishwasher while your child's doing homework.
Right. Okay. Really good information. I'm so glad we had this conversation too, because now I'm going to remove the box fan out of the bedroom, making some changes on my own too. Thank you, Dr. Schoemer.
Sure, no problem.
And if you're interested in learning more about UPMC Children's Community Pediatrics, we're going to have a link on our website at kdka.com/talkpittsburgh.